Phase 1 AETCOM module 1.3 is doctor-patient relationship. So this introductory session deals with the nature of doctor-patient relationship, then the importance of communication, transparency, shared responsibility, equality and vulnerability. So this session provides an overview for students with a perspective on doctor-patient relationship throughout their years of study. At the end of this session, students shall be able to describe the factors influencing doctor-patient relationship, enumerate the measures to strengthen doctor-patient relationship, enumerate positive outcome of healthy doctor-patient relationship, discuss the rights and responsibilities of patients, describe values of doctor-patient relationship, describe duties of physician to the patient, public and colleagues, and describe boundaries of doctor-patient relationship. Trust is the keystone of doctor-patient relationship. Both physicians' trust in patient and patients' trust in physician are very important and they give benefit to both of them. Trust is critical to patients' willingness to seek care, to reveal sensitive information, to submit patient treatment and follow up. So we can define this trust as a set of expectations that the healthcare provider will do the best for patient and with goodwill recognizing the patient's vulnerability. There are many factors affecting the doctor patient relationship. Some are related to the patient, some to the doctor, and some factors are related at the time of encounter of doctor patient. So related to the patient are socio-economic background, education and gender of the patient, their beliefs, religion, their prior knowledge and experience, and expectations from the physician. Related to the doctor are the knowledge, skill, attitude, and medical education and training, their legal framework. Related to the doctor and patient are access and availability to the service, communication, and making the patient comfortable. The doctor should be caring, compassionate, and empathetic at the time of treating the patient. And there should be a supportive environment, and the patient feedback and boundary rules are again important. Healthy doctor patient relationship will always lead to a positive outcome. So if the communication between doctor and the patient is appropriate, it will improve the diagnosis. It makes the patient comfortable to disclose intimate information which otherwise is not possible. And it not only improves the medical state but also emotional condition of a patient. And with a healthy relation, there will be better adherence to the treatment on the part of patient. The patient will also have regular follow up. It will lead to patient's satisfaction. There will be a feeling of fulfillment towards the doctor and other healthcare providers. A healthy relationship will boost patients' trust, confidence. It lessens the risk of medical misconduct and litigations, and the patient will start involving in taking care of themselves. So, a strong relationship will ultimately lead to an improved health outcome. To strengthen doctor patient relationship. So, if we introduce modules on ethics and moralism from first year of MBBS itself, it will help the future doctors to inculcate ethical values in their practice. Healthcare system is a team of interprofessional workers, not only physician But all the health workers should implement code of medical ethics. Health education teaches the patient to do self management and take care of themselves, and the patients will understand the care setting suitable for them, and it decreases the economical burden on them. Doctors should honor the opinion and decision of patients. Doctors should provide quality treatment without discrimination of patients. Doctor shoulders a shared responsibility for establishing diagnosis and treatment plan. A physician should provide information that is appropriate and unbiased about the medicines and treatment provided to the patient. Code of conduct for doctors in their relationship with the pharmaceuticals and allied health sector should be there. Certain conditions limiting the doctor patient relationship. So on the part of patient, means in certain situations the patient's agreement is not clear, and such conditions are if there is urgency or emergency medical care is needed, or medical care is requested for the patient by a treating physician. So when you go as a consultant, or when you have to provide medical care in special conditions like prisoners, so it is under medical guidelines given by the court, or if independent medical examination of the patient is needed, then again ethical guidance is very essential. So these are the limitations related to patient, and limitations related to physician are if the physician is not competent, or if the case or the patient's treatment is beyond the physician's competence or scope of practice, or if there is lack of resources, or if the physician's ability to provide care to the patient is again limited, or if the patient is very abusive, or if he threatens the doctor. In such conditions there is limitation to the doctor patient relationship. Now we will discuss the rights of a patient. So the first right is information. The patient has right to get all information regarding their illness, complications, investigations and treatment, risk, benefits and cost of treatment. Second right is right of records and reports. So patient has right to access original reports regarding investigation, discharge, if applicable death summary. Third right is emergency care, right of emergency care. So it is obligatory for a physician to provide emergency services to the patients without compromising safety of patients for monetary gains. Fifth is informed consent. So while taking informed consent, again it is mandatory for a physician to explain risk, complication if any, of the ongoing treatment or procedure in a simple language which the patient can understand, and should respect the decision taken by the patient. Then comes confidentiality. So, a physician should not disclose intimate information provided by the patient. It is the patient's right of privacy and confidentiality, except in sharing information in certain conditions where there is interest of others or interest of public health. Then is a right of second opinion. So if a patient feels it is necessary to take second opinion from other physicians, he has right to opt it. Then comes the patient education. So the patient has right to seek education regarding his health condition. He has again he has the right to get information about the rights and responsibilities of a patient. Next is seek redressal. So patient has right to express grievance and give feedback about the health care they received. Then protection, right to get protection in clinical trials. So clinical trials must be conducted by taking consent of the patient, written prescription of the drugs or interventions. Referral and transfer, right to referral and transfer. So the again, patient should be properly educated about the healthcare settings suitable for their health condition, and then they can choose where to go, and new options should be provided or should be made available by the physician. Then fifth is protection in biomedical research. So it is duty of a researcher to provide patient safety, and trial participants who suffer from any adverse effect or adverse impact, they are entitled to get free medical treatment for the same. Next right is right to choose source for medicines or test. So patient has the right to choose source of obtaining medicines or uh, conducting investigations and various tests from any registered pharmacy and registered laboratory of their choice. Important roles of patient are healthcare seeker, self monitor, communicator and collaborator. So health seeking is to have appropriate balance of well-being, whether the person is sick or not. He should continuously move towards self-care and strive for normal health. Second is self-monitor. Self-monitoring includes monitoring of clinical parameters, symptoms and daily activities. Next role is communicator. So communication is dominant dimension where patient comes for consultation. So high consideration and clarity of information exchanged by the patient are very valuable. And the fourth role is collaborator. So for patients to receive best healthcare possible, the patient has to collaborate with healthcare team workers. We will see the responsibilities of patient. So a patient should provide truthful, accurate and complete information of present, past and family. Patient should also inform about previous medications, surgeries, allergies, if any. Then the patient should ask questions if they are not able to understand any information related to health. Patient should politely cooperate with the physician and should adhere and follow the treatment plan beneficial for health. Patient should undergo routine health checkups periodically. A patient should respect the healthcare providers. Okay. Patient should have reasonable expectations. They should accept doctor expertise for mutual benefits. Then follow and other treatment plans beneficial for individual or public safety. Patient and their relatives should uh, refrain from being disruptive in the clinical settings. So what is patient satisfaction and how does it affect doctor patient relationship? We can say patient satisfaction is the degree to which individual regards the healthcare services provided to them were useful, effective and beneficial. So there are four important elements that have impact on the patient satisfaction. So they are trust, knowledge, regard and loyalty. There are certain fundamental rights and duties in doctor patient relationship. They are, first is communication. So communication plays vital role in doctor patient relationship. Here both patient as well as the doctor should have good communication skill. Patient should be able to explain what health difficulty he or she is facing, uh, and it should be followed by the doctor as well. So the doctor should be good listener. They should have good listening skills. They should listen to the patient carefully, patiently, and elaborate, explain the problem that the patient has and suggest them the necessary solution for that. Then the next is doctor empathy. So empathy is very important in proving doctor patient relationship. It helps the doctor to better understand symptoms that the patient has got, and also the need for the treatment. Next is trust. So most important thing in doctor patient relationship is trust. Trusting a particular doctor helps the patient to openly discuss his health issues. And trusting a doctor doesn't mean that the patient should have blind trust in the doctor. Next is consent information. So this is based on moral and legal arguments of the patient's autonomy, that is decision making power of the patient. Doctor here should be morally and legally, um, means he should consult the family members of the patient and counsel them on the positive as well as negative outcomes of the treatment, following which the patient should have complete independence in decision making, whether to continue the treatment or take discharge or move to any other hospital, or even taking second opinion. So these all things depend on the patient's opinion. And last is professional boundaries. So this deals with the doctors that misbehave with their patients by crossing the lines of or the limit of doctor patient relationship. And if there is misconduct, professional misconduct, so it's staring at a patient in inappropriate manner or burdening the patient with unnecessary personal information, these all come under professional boundaries. So there are certain situations where the doctor patient relationship is terminated, or the relationship may come to an end. So these conditions are: the physician concludes that the patient needs care of other specialists, some different specialist, or there is successive missing of appointments by a patient, or the physician refuses treatment due to nationality, religion, and other causes, or if the physician neglects a patient from prompt professional care without making arrangement for continuance of such care, that is patient abandonment. So the fundamental values of doctor patient relationship are altruism, compassion, service, and trustworthiness. So altruism means practicing unselfishly and with the concern for well-being of patients. Compassion is the deep awareness of suffering of others coupled with wish to relieve those sufferings. Service means the doctor should provide patient-centered service and should work for the benefit of patients. And trustworthiness helps the patient to receive maximum benefits from healthcare team. Duties of physician and doctor patient relationship are: duties individually to the patient are to implement professional competence, means doctors should keep their medical knowledge and skills updated by engaging themselves into lifelong learning. Then maintain privacy and confidentiality. So trust and effective communication are the means by which the physician will get appropriate information from the patients, and the physician has to maintain privacy and confidentiality in it. Then comes collaborative with patients and colleagues. To provide good quality care to the patients, physicians should work collaboratively with patient, their colleagues, and other members of healthcare team. Then managing conflict of interest. So the conflict of interest arises in particular situations. So the physician should recognize such situation and should make sure that the patient's interest remains uppermost. Then comes the duties for public, collectively for the public. So first is participating in self regulation. So our society grants privilege of self regulation to the physicians or doctors and our profession. In return they expect physicians commitment to altruism. So the goal of self regulation is to serve the public by providing best quality care. Second is reporting. So in some situations the physicians are legally expected to report that particular event or patient's condition to appropriate governing body, so they have to provide reports to them. Then third is educating. To improve the standard of profession and its service to the patient, physician must involve in educating and mentoring their peers, their colleagues and other friends. Then comes learning. So physician needs to learn and to share this knowledge and apply it in their medical practice. Then comes collaboration. So collaborative approach is very important. An individual physician has the responsibility to work collaboratively with other members of the healthcare team. Then the duties towards their colleagues are: first is mentorship. So to provide high standard of excellence in healthcare, the physician should mentor their friends or their professional colleagues. Then comes health awareness. So physician must be aware of their own health. And last is collegial behavior. So collegiality is the cooperative approach between the colleagues,